Hello students. In this class, we shall discuss about carbohydrate chemistry. This class is going to be the continuation of previous two lectures on carbohydrate chemistry. Specific learning objectives of today's class are: at the end of the lecture, the student should be able to describe the structure and functions of proteoglycans. Describe the structure, functions, and associated disorders of glycosaminoglycans with relevant examples. Explain the structure, types, and biological significance of glycoproteins. First, we shall recollect about classification of carbohydrates. Carbohydrates can be classified into monosaccharides, disaccharides, oligosaccharides, and polysaccharides. And in previous classes, we have already discussed about monosaccharides, disaccharides, oligosaccharides, and homopolysaccharides. In this class, we shall discuss about heteropolysaccharides. About heteropolysaccharides. So heteropolysaccharides are otherwise called as heteroglycans. So heteropolysaccharides are categorized under polysaccharides. So what are polysaccharides? Polysaccharides means they are carbohydrates which have more than 10 monosaccharide units. What is the word hetero means? Hetero means different. So it contains different types of monosaccharide units or their derivatives. The examples of heteropolysaccharides are agar, agarose, gum, and pectin. And the most importantly, we have to read the examples of mucopolysaccharides or glycosaminoglycans called as GAGs. It can be asked as a 5-mark question. Mucopolysaccharides or GAGs include hyaluronic acid, chondroitin sulfate, keratin sulfate, dermatin sulfate, heparin sulfate, and heparin. We need to study about the names of GAGs, their composition, their functions, and clinical applications. We shall discuss shortly about agar, agarose, pectin, and gums. First, we shall discuss about agar. Agar, it is mostly found in seaweeds and marine algae. Agar is a polymer of galactose, glucose, and sulfate. Agar is a non-digestible dietary fiber. Next, about agarose. Agarose is a polymer of galactose and free 6-anhydrogalactose. It is useful in laboratory as a major component of microbial culture media and also in electrophoresis. Next, about pectin and gums. Pectin and gums are non-digestible dietary fibers. They are found in apples and citrus fruits and they are employed in preparation of jellies. Now we shall start the discussion about mucopolysaccharides or glycosaminoglycans or GAGs. This is a frequently asked 5-mark question. These are named as mucopolysaccharides because it was first discovered in mucin or mucus secretions. But later they found out that it is not only present in mucus secretions. Structure-wise, these gags are long, negatively charged, unbranched heteropolysaccharide units. They are generally composed of a repeating disaccharide unit. One unit will be made up of glucuronic acid and another unit will be made up of amino sugars. Amino sugars may be either acetylated or sulfated, which contributes to the negative charge. These gags can occur associated with a small amount of protein. If gags are associated with protein, it forms proteoglycans, but it will have only small amount of protein. More than 95% will be carbohydrates. How we can see about proteoglycans? Proteoglycans can exist as monomer, and if these proteoglycan monomers are getting associated or aggregated, then they form proteoglycan aggregates. So the structure of proteoglycan monomer is similar to bottle brush. We can see in this picture, this green color is nothing but gag, and this red color is core protein. So more than 95% of proteoglycans is made up of gags and a small amount is made up of protein. The linkage between the core protein and gags is by covalent linkage. If these proteoglycan monomers are getting aggregated, then they will form proteoglycan aggregate. How they are getting aggregated? This proteoglycans can get associated with a molecule of hyaluronic acid. Hyaluronic acid is depicted in blue color here. So this proteoglycans monomers can associated with the molecule of hyaluronic acid to form proteoglycan aggregates. The association is not covalent, but it occurs primarily through ionic interaction between the spore protein and hyaluronic acid. The association is even more stabilized by a small protein called as link proteins. Link proteins are depicted in yellow color here. So together they will form proteoglycan aggregate. These proteoglycan aggregates are components of extracellular matrix in addition to collagen, fibrillin, elastin, and all. Now we shall see about properties and functions of proteoglycans. The first property is it can bind with large amount of water. You can imagine a sponge which can absorb large amount of water. We know proteoglycans are major part of extracellular matrix. It forms viscous gel-like matrix which is responsible for flexible mechanical support of our extracellular matrix, and it also functions as cushion or lubricant against mechanical shock. So it is a major component of extracellular matrix and it supports cellular and fibrous components of tissues, and it also mediates cell to cell signaling and adhesion. Now we shall see about the structural composition of GAGs, that is glycosaminoglycans. So we know glycosaminoglycans are heteropolysaccharides which are made up of repeating disaccharide units. The repeating disaccharide units, one unit will be in the form of amino sugar, another unit will be in the form of uronic acid. So the first unit in the form of amino sugars can be either exist as glucosamine or galactosamine, and the second subunit uronic acid can either be glucuronic acid or iduronic acid. And we have already seen the list of glycosaminoglycans. We shall recall again. The list of glycosaminoglycans include hyaluronic acid, chondroitin sulfate, dermatan sulfate, keratan sulfate, heparin, and heparan sulfate. First, we'll start with the first glycosaminoglycan, that is hyaluronic acid. Hyaluronic acid is made up of N-acetyl glucosamine and glucuronic acid. So, the amino sugar component here is N-acetyl glucosamine. The uronic acid component here is glucuronic acid. How this hyaluronic acid is unique? How is it different from other glycosaminoglycans? It is the only glycosaminoglycan which is unsulfated. It is not covalently attached to protein. And this is the only gap which is not only limited to the animal tissue but also found in bacteria. Location of hyaluronic acid. It is mainly present in tendons, synovial fluid, vitreous humor, umbilical cord, and loose connective tissues. The functions of hyaluronic acid includes it serves as a lubricant and shock absorber. Now we shall see about an enzyme called as hyaluronidase. So hyaluronidase means this enzyme is going to cleave hyaluronic acid. How it is going to cleave? It is breaking beta 1,4 linkage of hyaluronic acid. Where is this hyaluronidase present? Hyaluronidase is present in testis, seminal fluid, certain snakes and insect venoms. Now, what is the function of this hyaluronidase? Hyaluronidase, which is present in semen, plays an important role in fertilization. It clears the gel around the ovum, allowing patent penetration of sperm. Likewise, it is also present in bacteria, which helps their invasion into animal tissues. We shall discuss about the next glycosaminoglycan, that is chondroitin sulfate. Chondroitin sulfate is made up of N-acetyl galactosamine and glucuronic acid. It is most abundant gas in the body. It forms proteoglycan monomer and it links to 4-protein covalently. Whereas hyaluronic acid, which we previously discussed, it doesn't form proteoglycan monomer and the linkage to 4-protein is not covalent. Location of chondroitin sulfate. The name itself tells chondro means cartilage. So the location of chondroitin sulfate is in cartilage, tendons, ligaments, and aorta. In cartilage, they bind to collagen and hold the fibers in a tight and strong network. Functions. It helps to maintain the structure and shape of tissues. Next, about dermatan sulfate. Dermatan sulfate is composed of N-acetyl galactosamine and L-iduronic acid. As the name suggests, derma means skin. Thus, dermatan sulfate is located in skin, blood vessels, and heart valves. The main function of dermatan sulfate is to maintain shape of the skin. Next, about keratin sulfate. Keratin sulfate is composed of N-acetyl glucosamine and galactose. So, here there is no uronic acid. This is the only gas which does not contain any uronic acid. Location. It is present in cornea and tendons. Function. It keeps the cornea transparent. Next, about heparin. Heparin is composed of glucosamine and L-iduronic acid. Location. Unlike other glycosaminoglycans, which are present extracellularly, heparin is an intracellular component of mast cells that line arteries, especially in liver, lungs, and skin. The major function of heparin is anticoagulant. Anticoagulant means it is against coagulation. That is, it prevents clotting. Thus, it prevents intravascular coagulation. Uses. Heparin is used in Treatment of thromboembolic disorders. How heparin acts as anticoagulant. We will see the mechanism of action of heparin as anticoagulant. Heparin activates antithrombin 3. Thus, it inactivates thrombin and other clotting factors. Thereby, it can prevent clotting. Next, about heparan sulfate. Heparan sulfate is composed of glucosamine and L-iduronic acid. It is similar to heparin, but there some glucosamines are acetylated and there are fewer sulfate groups. Location: heparan sulfate is extracellular gag similar to all other gags, but we know heparin is the only intracellular gag. It is present in basement membrane and it is also ubiquitous component of cell surfaces. Let us revise about glycosaminoglycans. Biologically important glycosaminoglycans are hyaluronic acid, chondroitin sulfate, dermatan sulfate, keratan sulfate, heparin, and heparan sulfate. We need to recollect about the composition of each and the location and biological importance of each glycosaminoglycan. Glycosaminoglycans are heteropolysaccharides which are made up of repeating disaccharide units. The first unit is amino sugar and the second unit is uronic acid. First, the hyaluronic acid is the only glycosaminoglycan without sulfate group. Chondroitin sulfate is the most abundant glycosaminoglycan. Keratan sulfate is the only glycosaminoglycan without uronic acid. Now we shall recollect about the composition. Since glucose is the most commonly available sugar, we can remember that for first glycosaminoglycan. So glucose in the form of amino sugar, that is glucosamine, which is acetylated N-acetyl glucosamine, and glucuronic acid are present in hyaluronic acid. Whereas in chondroitin sulfate and dermatan sulfate, the amino sugar is N-acetyl galactosamine. How we can remember this fact is we can have a mnemonic in our mind, that is the fashion throughout galaxy is skin and bone. Galaxy we can remember for galactose. Skin, dermatan, bone, chondroitin, that is cartilage, bone cartilage, that is chondroitin. So, chondroitin sulfate and dermatan sulfate contains N-acetyl galactosamine, whereas the uronic acid in chondroitin sulfate is glucuronic acid, whereas uronic acid in dermatan sulfate is L-iduronic acid. As I have already told, keratan sulfate is the only glycosaminoglycan without uronic acid. So there is no uronic acid here. It is simply galactose. N-acetyl glucosamine plus galactose. There is no uronic acid here. Heparin and heparan sulfate both are composed of glucosamine and L-iduronic acid. So, L-iduronic acid is present in heparin, heparan sulfate and dermatan sulfate. Let's see about the location. So, hyaluronic acid, it is mainly responsible for lubrication. So, we can remember some locations like synovial fluid, vitreous humor. Then chondroitin sulfate names itself is telling it is mainly present in cartilage. Dermatan sulfate, derma means skin, so it is mainly present in skin and also in blood vessels and heart valves. Keratin sulfate is responsible for maintaining transparency of cornea. So we can tell in cornea, keratin sulfate is present. Heparin is the only intracellular gas which is present in mast cells which acts as anticoagulant. Heparan sulfate is extracellular like all other glycosaminoglycans and it is present in basement membrane. Diseases related to proteoglycans. The group of diseases are called as mucopolysaccharidosis. They are the group of lysosomal storage disorders where there is intralysosomal accumulation of mucopolysaccharides. Thus, mucopolysaccharides are excreted in urine in abnormal amounts. The main clinical features includes skeletal deformities, that is deformities in skeleton, bones, short stature, joint contractures, dysostosis multiplex. That means multiple joints are involved here. There are multiple skeletal abnormalities. Coarse facies. Coarse facies means we can see this picture. We can focus on the boy's face. The boy is having low set ears, depressed nasal bridge, then large tongue, that is macroglossia, and there is increased space between teeth, that is spaced dentition, and short neck. Organomegaly, that is organ enlargement. Here we can see hepatosplenomegaly. Hepato means liver, spleno means spleen. So enlargement of liver and spleen. Mental retardation, that is intellectual disability, reduced IQ. Blindness because of corneal and retinal involvement and also deafness. We can see a characteristic finding called corneal clouding, which is exclusively present in type 1 mucopolysaccharidosis. There are more than 10 types of mucopolysaccharidosis, but we need to discuss about the important mucopolysaccharidosis, that is mucopolysaccharidosis 1 and 2. Mucopolysaccharidosis 1 is called Hurler's syndrome. The mild form of mucopolysaccharidosis 1 is called Sky's syndrome. Mucopolysaccharidosis 2 is called Hunter syndrome. The enzyme defective in mucopolysaccharidosis 1 is L-iduronidase, whereas the enzyme defective in mucopolysaccharidosis 2 is iduronate sulfatase. In both of these disorders, glycosaminoglycan which gets affected is dermatan sulfate and heparan sulfate. These dermatan sulfate and heparan sulfate are getting excreted in urine. We have seen the common clinical features of mucopolysaccharidosis in previous slide. The characteristic clinical feature of mucopolysaccharidosis 1 is corneal clouding. So, if you have corneal clouding in your case scenario, the first Differential diagnosis you need to keep in mind is Hurler's syndrome. Case scenario number 1. A 5-year-old boy is brought by his mother with complaints of difficulty in walking and joint stiffness for past 6 months. She complains that the abdomen is protruded and he has difficulty in seeing objects. On examination, child has corneal clouding, low set ears, depressed nasal bridge, macroglossia, spaced dentition, and short neck. Abdominal examination revealed hepatosplenomegaly. Urine showed the presence of heparan sulfate and dermatan sulfate. Enzyme assay in fibroblast reveals deficiency of L-iduronidase. So, what is your probable diagnosis? This is mucopolysaccharidosis 1, that is Hurler's disease. There is skeletal deformity, visual defect, characteristic feature of corneal clouding, coarse facial features, hepatosplenomegaly, and the accumulation of heparan sulfate and dermatan sulfate due to the deficiency of enzyme L-iduronidase. Case scenario number 2. A 3-year-old boy is brought by his mother with history of pain in lower limb and difficulty in walking for past 4 months. History of delayed milestones was present. On examination, child had coarse facial features, short stature, and low IQ. Cornea was clear. Child had stiffness of joints in hand and lower limb. Abdominal examination revealed hepatosplenomegaly. Urine showed the presence of heparan sulfate and dermatan sulfate. Enzyme assay in fibroblasts reveals deficiency of iduronate 2 sulfatase. What is your probable diagnosis? It is mucopolysaccharidosis type 2, that is Hunter's disease. The clinical features include skeletal deformities, delayed milestones, coarse facial features, short stature, mental retardation. There is no corneal clouding. Cornea was clear. Skeletal deformities which include joint stiffness and organomegaly, that is hepatosplenomegaly. Urine showed the presence of heparan sulfate and dermatan sulfate due to the deficiency of enzyme iduronate 2 sulfatase. So this is mucopolysaccharidosis type 2, Hunter's disease. Till now what we have discussed was about proteoglycans and its component glycosaminoglycans. In proteoglycans, the carbohydrate content was maximum, that is more than 95%. Now we shall see about glycoproteins where carbohydrate content is only less than 10%. Glycoproteins are formed by attachment of oligosaccharide to polypeptide chain. How they are getting attached? It is by either O-linked, that is O-glycosidic linkages, or N-linked, that is by N-glycosidic linkages. O-glycosidic linkages means here the carbohydrate is linked to serine or threonine residue, whereas N-glycosidic linkages means the carbohydrates are attached to amide nitrogen of either asparagine or glutamine residues. The main functions of glycoproteins include cell adhesion, cell recognition, cell to cell interaction, lubrication, protection from proteolytic degradation, and blood group substances. Let us summarize today's class. Carbohydrates are classified into mono, di, oligo, and polysaccharides. Polysaccharides are in turn classified into homo and heteropolysaccharides. In this class, we started with heteropolysaccharides definition and examples. Then we studied about proteoglycans, monomer, aggregates and their structure and importance of proteoglycans in extracellular matrix. Then we discussed about component of proteoglycan, that is glycosaminoglycan or mucopolysaccharide. We discussed about the composition, location and functions of biologically important glycosaminoglycans. Then we discussed the associated disorders called mucopolysaccharidosis. We discussed Hurler disease and Hunter disease with case scenarios. Then about glycoproteins. Thank you.